Welcome to the fourth episode of Boulder Community Health's Be Well Saturdays. I'm Gina Simmering, your host, and for those of you that are new to Be Well, this is a monthly series that shares health and wellness information from Boulder Community Health physicians and our wonderful community partners. In today's episode, I had the opportunity to sit down one-on-one with Dr. Amie Meditz to answer a handful of your COVID-19 questions. We will also hear from community partners about urban hiking throughout Boulder County, cooking at home during COVID time, and learn techniques for deep breathing for greater ease. And as is customary for Be Well, we love to give away free prizes to our listeners. So please stay with us until the end for the opportunity to win a $100 gift card to the pedestrian shops. So stay tuned. Let's get started. I'm here with Dr. Amie Meditz, infectious disease physician at Boulder Community Health. And as a follow-up to our last Be Well episode, Dr. Meditz will be answering your top COVID-19 questions that were sent in by our listeners. Thank you so much, Dr. Meditz, for joining us. Are you ready to get started?
Yeah, thanks for having me back, Gina. I really appreciate it, and welcome back to our home.
Thank you. So the first question, is COVID-19 swab testing accurate?
So thanks, Gina, for that question. This is probably one of the most common questions and common misconceptions, but COVID-19 swab testing is very accurate. So first, on this graphic, at time 0 is the point that you are infected. And the average time to symptoms is 5 days. So if you can see down the middle of this graphic, there's cartoon viral particles, and they're increasing in concentration as you go from left to right. This is just referring to the increase in concentration of the virus with a peak viral concentration at 7 to 8 days after infection, in which millions of viral particles are in your nose. So the tests that we have at Boulder Community only need 5 to 500 viral particles to detect. So we'll have millions in your nose, very easy to detect it. So by the time you have symptoms, the amount of virus in your nose is way over the amount that is needed to be detected with this swab. So the one other thing that I want to point out is that as the research has gone on with the time course of COVID-19, is that researchers have found that after day 9, individuals are really no longer contagious. So, but the important piece of information is that these pieces of virus can be left in our nose for up to 3 months, but they're not capable of causing infection. So this is why it's so troublesome regarding repeat testing, because the virus could be present because the test is just testing for the genetic material, not active viral particles. So you could test positive for 3 months, but it doesn't necessarily mean you're infectious. The test just says that those particles are there, and you have to use somebody's symptoms to figure out whether they're contagious.
Okay. So that leads into the next question. What is the difference between isolation and quarantine?
So this is also confusing for both the general public as well as healthcare providers. So let's just imagine somebody told you you were positive. So if you were tested with a swab and they told you were positive, the term that we use is that you have to be in isolation. So that means you have to go home and be away from others. The timing for this is if you have no symptoms, the only thing we have to use is the first test that's positive. So from the first test positive, you have to be at home for 10 days. If you have symptoms, you get to start counting 10 days from the first day that you had symptoms. And then you go 10 days from that, and as long as you haven't had a fever for 24 hours at the end of that time frame, you no longer have to isolate. Now, if you have ongoing fever, you have to continue to isolate until you don't have a fever for 24 hours. Now, on the other hand, quarantine is if you have an exposure to someone with known COVID-19. So this is somebody who tested positive and you were around them. Well, how much do you have to be around them? You have to be with them for 15 minutes at a distance of closer than 6 feet. So you may ask me, well, Amie, you didn't mention anything about the masks. Well, the CDC doesn't use that in the guidance for community exposure because communities, people in the community have not had training on how to wear a mask. So in an effort to be conservative, they've made this criteria not including the mask. So if you were around somebody with those two criteria, known COVID positive, you have to isolate for 14 days. And that's to just give a wider range to allow for symptom onset or not, or resolution. So if you do develop symptoms during that time, it is recommended to get tested.
Okay, this next question, it seems so simple, but we've all seen people, maybe not on purpose, but doing it incorrectly.
Yeah.
What is the proper way to wear a mask?
So that is a great question. So you want to wear your mask over your nose and under your chin, is the proper way of wearing a mask, kind of like this. And if you wear your mask this way and you are with somebody who ends up having COVID, really your risk for getting COVID-19 is very, very low. If you are wearing your mask this way and they are wearing their mask this way, the risk of exposure is very low. So this is why it's important to wear your mask properly.
And then the last question, and this goes along so well with Be Well, is we've learned about hand washing, social distancing, and wearing a mask. Is there anything else we can do to keep ourselves healthy?
Yeah, thank you for that question. Patients have asked me this question over the years. They have, an acute illness. They want to know how to be healthy going forward. And really what the advice I give to people is just how I live my life, which is to eat fresh foods that I make at home and that I've gotten takeout from some of our local restaurants that make wonderful fresh foods. That include vegetables and lean proteins. But I will totally and readily admit I have a terrible sweet tooth and I love to splurge. So I'll have a decadent dessert every once in a while. It's really important that we all moderate our alcohol intake. Women are allowed 1 drink a day, men 2. And then exercising. Exercising is so important. And I exercise outdoors or down in my basement on my bike that's set up on a trainer. The physical side of health is so easy to talk about. It's the actionable items. But the emotional side of the pandemic has been such a great challenge. I was driving home from work the other day and I heard this song by Rick Springfield. And I think everybody out there has probably heard it. We all need the human touch. And I really thought that spoke to me, that's what I feel like I'm lacking a lot. I admit I feel helpless, worn out, hopeless even, and disconnected from my family. And one of the ways that I've coped with this is I call my cousin on my way to work or on my way home. And she just listens to me. She gives me permission to have those feelings. She doesn't give me any advice. She just kind of listens to me and tells me that it's hard. And that gives me a little relief from the pressure on my chest. And I hope that you can find somebody like that that can just listen to your feelings. If you don't have somebody, please reach out to your provider to help you connect you with someone that could help you, or online resources. I've made a couple micro adjustments to my life, meeting with people outdoors, distanced, wearing a mask, letting our dogs play over there, getting takeout. One other thing that I've noticed was that my dad is getting solace from digging deep into the projects around the house and getting them all completed. So there's a lot of different ways, you know, that I've tried to stay as grounded as I can.
I'm Darcy Kitching, author of the new trail guide, The Best Urban Hikes Boulder. It was just published this year by the Colorado Mountain Club Press. I loved putting this book together. It highlights 22 walks and hikes all around Boulder County, but unlike other Boulder trail guides, this guide really focuses on everything east of the foothills. It doesn't include all those big mountain hikes. So these 22 walks and hikes are actually accessible to people across the lifespan and with a variety of mobility levels. So I hope that it's something that everyone in the county can really enjoy, whether you live here or you're visiting. These are practical, everyday hikes and walks that connect to larger trail systems and places to stop and rest, and even places to grab a cup of coffee or a snack. For instance, the last hike in the book is called the Niwot Loop Adventure, and it's a 6-mile loop that goes all the way around a system that actually has a lot of trails inside of it. So you can choose your own adventure on most of these hikes. That's what makes it so interesting to do urban hiking, because urban hiking is unlike any other kind of hiking where you might start at a trailhead and find yourself far off in the wilderness somewhere. In urban hiking, with urban hiking, you actually are still in civilization. You can stop, you can choose your own adventure, you can trade up, you can hop onto a different link if you like to. So everything in the book really opens the opportunity to explore where you live. These hikes are in the city of Boulder, Longmont, Louisville, Lafayette, Niwot, and Superior. And they're trails that are maintained by Boulder County and also those cities within the county. And most of them have very little elevation gain. So again, they're very accessible. You can take strollers or even bikes with your little kids if your kids want to bike and you want to walk. It really makes it easy. Some of these trails even connect municipalities. One of my favorites is linking 3 cities on the Coal Creek Trail. It starts in Lafayette and ends in Superior, and you get to see so many amazing wonders. These are hikes that immerse you in nature in the city. And I'm offering an opportunity for everyone who watches Be Well Saturdays. I've created a PDF with 4 additional urban hikes that we couldn't fit in the book. We wanted to keep the book nice and compact and affordable. So I created a PDF with these 4 bonus hikes. And if you send me an email at besturbanhikesboulder@gmail.com, I'll be happy to send you that PDF and you can just get started right away. But I hope that this is a book that will be useful to you and your friends and visitors, anybody you know who lives in Boulder or is just passing through, who could really use some more opportunities for everyday adventure, great exercise, ways to get outside and challenge yourself within the scope of what you can do in a normal day. So these are great urban hikes. I hope that you enjoy them, and happy urban hiking.
Hello, my name is Stephen Menyhart. I'm the Operations Manager with Boulder Valley School District Food Services Department, and I'm broadcasting today to show a simple summer gazpacho salad. And I'm creating this dish here in our brand new BVSD Culinary Center, which was funded by the 2014 bond. So here we go. So we have an array of seasonal produce that you'll see here on my board. The pre-cutting I've done, I'll go through the ingredients that we'll be using for the gazpacho salad. I have some fresh cherry tomatoes. If they're larger tomatoes, cut them in half, and then again in quarters. If it's a smaller tomato, you could probably get away with halves. I have some fresh cucumber, your choice to peel or leave or unpeel. I have a yellow summer squash, just a section of one, and then a fresh squeaky green pepper. So this will be the basis for our gazpacho. The only seasoning that we'll be using is salt and vinegar. So that's the entire seasoning palette. So with the cucumber, it's your choice again if you want to leave it peeled or unpeeled. If you don't prefer the seeds, you could also take a soup spoon or a small metal spoon and peel or get those seeds out. But in this case, I'll leave them. I'm going to cut these into, I'll cut these each into about 4 strips. And then we'll cut across into kind of a medium to large dice. Something that the recipient or eater of the salad could either use with a fork or spoon. So you do want to serve this salad fresh. It will produce some liquid. So here's our cucumbers. I'll toss these into the salad. I already have a little bit of pre-chopped cucumber and squash. I'm going to add some cucumber here. Squash, same thing. If you'd like to remove the seeds or the central portion, you could, but not necessary. So I'm just going to do the same sort of cut style as the cucumber. I'll go down with this just into 3 sections each. And again, medium to large dice. You want to keep a consistent size so that the salad is pretty uniform in terms of the cut size. I'll add this to the mix. As far as peppers, there's many ways to cut a pepper, but what we'll do today is take off the 2 ends, set those aside for a minute. I'll just cut down here just in 1 strip, and I'll remove this as much of the pith and seeds as I can. Just get some of this pith out. If it's being a little stubborn, you could use a knife. Just get all the white out of the center of the pepper. So then I'll cut this pepper down into strips. Use a sharp knife to get through that thick pepper skin. Again, we're going for kind of a roughly the same size dice. The peppers may be a little smaller just because it's a thinner vegetable. And I should mention as I do this, this whole dish could also be blended and put in a blender more like a traditional gazpacho. But this is kind of a nice, fresh, chunky way to do it for the summer. So I'll add this to the mix. As far as what to do with your last bits of pepper, you can just cut those down. The ends of the pepper will never give you quite as uniform of a size. With this piece, just pop the end out. Again, if you want to remove some of the white pith, feel free. Again, matter of taste. And then we'll put up the remainder. And this is literally, I would call a 5-minute salad once you have all your produce set and washed. So here's our combination of peppers, squash, cucumber. And then I have my tomatoes pre-cut. I'm going to toss those in. And then I'll add my 2 seasoning. Again, season to taste with salt and vinegar. You could use a red wine vinegar, a sherry vinegar. I wouldn't suggest something like a heavier colored balsamic because it'll taint the color of the vegetables. But I'm going to add my salt, touch of vinegar. Just make sure that your salt and vinegar are nicely balanced. I'm going to put the entire vegetable dish into a bowl. Either toss or mix with a spoon. Make sure it's uniform. Make sure the salt and vinegar is nicely distributed throughout the salad. You could always add more tomatoes, less tomatoes. The better your tomatoes and the fresher, the more tomatoes you're going to want as a part of the salad. The other optional addition at this point would be avocado, which you would want to add at the last minute. You could add some touch of sliced avocado. But again, very simple, taking advantage of the best of the Colorado season. And there's our simple summer gazpacho.
My name's Matt Kapanis, and I am a yoga teacher here in Boulder, Colorado. And I want to talk to you today about a simple breathwork technique that you can use. You could offer this to your kids, cohorts, anybody who's working with a little bit of anxiety now, and I'm not talking about sort of that intense clinical anxiety that might need medication, but that low level sort of tension that I think a lot of us are feeling right now due to the just general uncertainty of our times. And Bloomberg recently had an article about the impending mental health epidemic that is going to be kind of hitting us as a second wave after COVID, just due to things like financial situations, unemployment, homelessness. So we really have some work cut out for us to kind of stay grounded and still operate effectively during these sort of tumultuous times. And so I want to share with you a very simple technique, and it may seem almost like it's too simple, like, hey, that really can't be that magic. And it's not that magic. I will share that there was another article that came out a couple years ago in the New York Times about the power of deep breathing and the way that it works to mitigate anxiety and worry. And basically, the gist of the article was that when you take deep, conscious breaths, not just like when you're driving in your car, but you're focusing on your breath, you actually bypass the arousal pathways in your own brain. You direct mental energy through a different channel that actually begins to settle you pretty quickly. So if you were going to do this with me now, we can take maybe all of 30 seconds to sort of get the rhythm and the cadence of this. I would say you can close your eyes or you can keep your eyes open, but simply take a big breath in to sort of a count of 5, 4, 3, 2, 1, and then you exhale 5, 4, 3, 2, 1, and you would just repeat that. Inhale 5, 4, 3, 2, 1. Exhale 5, 4, 3, 2, 1. And that would be it. You just repeat that until you feel what I would say is a noticeable sort of shift in your nervous system's energy. And it shouldn't take a long time. And some of you may do less than 5. You may count a little quicker. You may count a little slower. I think everybody has a different lung capacity, but that's it. And there's not much more sort of flashiness or technique other than that. Just counting to yourself a steady rhythm of inhales and exhales and letting your body sort of encounter a more soothed state of being through that process. Again, it's all rooted in science. When your mom told you, when you came in all revved up from something, hey, take a couple deep breaths, she was on to something. And there was a certain wisdom that I think humans have known for a long time. But science is now kind of coming to the level of even understanding why taking a few deep breaths can have such a potent calming effect on us. Some of us are feeling a little too alive right now, and so I give you that simple technique of just slow, deep breathing during these times to calm yourself down, to calm your kids down, whoever needs it. Just find some space, give yourself a moment to get out of your head, into your breath, and I think you'll find that you're a little bit more better equipped to cope with sort of the chaos of these times. So that's it. Matt Kapanis signing off.
Well, thank you so much to this fabulous speaker panel. And thank you to our listeners for joining us today. If there are particular topics you would like to see covered on Be Well, feel free to send me an email. My email address is listed below. And now for the opportunity to win a $100 gift card to the pedestrian shops. I'm sure that we could all use a new pair of sneaks about right now. Be the first person to answer this scenario correctly. Yes, it's a scenario. We're making it a little tougher. Send me an email with the correct answer and you're the winner. So here goes. My best friend who felt well briefly came into town and we hung out for 2 hours on the opposite sides of my kitchen table, about 2 feet apart. She drove back to Durango and a day later, she called me and said she tested positive for COVID-19. We both wore a mask the whole time. Am I exposed and why? Send me your answer. Until next time, everyone, stay healthy and be well.